Otitis media, complicated word. Again, otitis meaning infection, media meaning middle. So we're talking about a middle ear infection. Well, how does this happen? Well, here, if you look at the model, the eustachian tube is integral in this process. When the eustachian tube doesn't work well because of a viral illness or a congenital malformation of the function of the eustachian tube, what happens is you get negative pressure in the middle ear, and fluid is imbibed from the lining of the middle ear. As fluid accumulates in the middle ear, it creates a situation called otitis media. The most common complaints of someone with otitis media: hearing loss, pain in the ear if the infection is acute and sharp, pressure in the ear. Common symptoms of otitis media are plugging sensation of the ear, inability to hear from the ear as clearly as the other side, and in cases with acute infection, pain of the ear. How do we treat otitis media? Well, the most common way to treat this is with antibiotics, antihistamines, and decongestants. Antibiotics are used when there's pain involved. And usually, once you start antibiotics for otitis media, the pain resolves in 48 hours. If it doesn't, the antibiotics need to be changed. When do you have to put tubes in a situation where you have otitis media? And there are 4 basic indications for tubes. One is persistent middle ear fluid that doesn't resolve to antibiotics. 2 is complications from otitis media. For example, sensory hearing loss, facial paralysis, meningitis. These are all good indications for putting a tympanostomy tube or inserting a tube into the eardrum. Another reason for putting tubes in is in a patient who is immunocompromised in some way. If they're on chemotherapy, if they have immunodeficiency syndromes, these are all good reasons to use tubes, to drain the infection. In these patients, infection left untreated can spread very quickly.